Hello, welcome back to Healthy Lifestyle Tips. Today, we're diving into a topic that affects millions of women worldwide: breast cancer. Breast cancer is a complex disease that requires a comprehensive understanding to ensure early detection, effective treatment, and a better chance of survival. Join us as we explore all aspects of breast cancer, from risk factors to prevention strategies, empowering you with knowledge to prioritize your health and well-being. What is breast cancer? Breast cancer is a type of cancer that forms in the cells of the breast. It occurs when normal breast cells mutate and divide uncontrollably, forming a tumor. These tumors can be either benign, non-cancerous, or malignant, cancerous. Malignant tumors have the potential to spread to other parts of the body if left untreated. Early detection and prompt intervention are crucial for successful treatment. Risk factors. Understanding the risk factors associated with breast cancer is crucial for both prevention and early detection. While the exact cause of breast cancer remains unknown, researchers have identified several factors that can increase the likelihood of developing the disease. It's important to note that having one or more risk factors does not automatically mean an individual will develop breast cancer, but being aware of these factors allows individuals to take proactive measures to reduce their risk. Age. The risk of breast cancer increases with age. Women over the age of 50 are more susceptible to developing breast cancer compared to younger women. However, it's essential to remember that breast cancer can occur at any age, and early detection is vital regardless of age. Family history. A significant risk factor for breast cancer is having a family history of the disease. If a close blood relative, such as a mother, sister, or daughter, has had breast cancer, the risk of developing the disease is higher. Certain gene mutations, such as BRCA1 and BRCA2, are also associated with an increased risk of breast cancer. Personal history. A personal history of breast abnormalities, such as a previous breast cancer diagnosis, increases the risk of developing breast cancer in the future. Additionally, certain non-cancerous breast conditions, such as atypical hyperplasia or lobular carcinoma in situ, LCIS, can also elevate the risk. Hormonal factors. Hormonal factors play a significant role in breast cancer development. Women who started menstruating early, before the age of 12, or experienced late menopause, after the age of 55, have a slightly higher risk. Prolonged exposure to estrogen due to the use of hormone replacement therapy, HRT, or oral contraceptives can also increase the risk, although the overall increase is small. Obesity. Maintaining a healthy weight is important for overall health, and it also contributes to reducing the risk of breast cancer. Obesity, especially after menopause, has been linked to an increased risk of developing the disease. Fat tissue produces estrogen, and higher estrogen levels can promote the growth of certain types of breast cancer. Alcohol consumption. Research has shown a clear link between alcohol consumption and an increased risk of breast cancer. Even moderate alcohol consumption can elevate the risk. To minimize risk, it is recommended to limit alcohol intake or avoid it altogether. Exposure to radiation. Previous exposure to radiation, particularly during adolescence or early adulthood, increases the risk of developing breast cancer later in life. This exposure could be due to previous radiation treatments for other medical conditions or radiation exposure from nuclear accidents. Signs and symptoms. One of the most common signs of breast cancer is the presence of a lump or thickening in the breast or underarm area. These lumps may feel distinct from the surrounding breast tissue and can vary in size and texture. It's essential to perform regular self-breast exams to become familiar with the normal texture and appearance of your breasts, as this will help you identify any abnormalities. Changes in breast size or shape can also be an indication of potential breast cancer. This may involve one breast becoming noticeably larger or smaller than the other, or a change in the overall shape and contour of the breast. These alterations should be carefully observed and evaluated by a healthcare professional to determine their cause. Nipple abnormalities, such as inversion, when the nipple turns inward, or discharge, can be a cause for concern. While nipple inversion can be a normal variation for some individuals, sudden or persistent inversion should be assessed by a medical professional. Discharge from the nipple, especially if it is bloody, clear, or occurs spontaneously, should also be examined by a healthcare provider to rule out any underlying issues. Breast pain, although commonly associated with benign conditions, can also be a symptom of breast cancer. The pain may vary in intensity, duration, and location. It's essential to pay attention to any new or unexplained breast pain, particularly if it persists or is accompanied by other concerning symptoms. Skin changes on the breast can also be indicative of breast cancer. Dimpling or puckering of the breast skin, resembling the texture of an orange peel, may occur due to cancerous growth pulling on the connective tissue within the breast. Additionally, redness or scaling of the breast skin, similar to eczema-like patches, can be an alarming sign that requires medical evaluation. Screening and early detection. Regular screening plays a pivotal role in the battle against breast cancer. It enables early detection, which significantly improves the chances of successful treatment and enhances overall outcomes. There are several effective methods employed for breast cancer screening, including mammography, clinical breast exams, and self-breast exams. Each of these approaches serves a unique purpose in identifying potential abnormalities and should be used in conjunction with professional guidance. Mammography is a widely utilized screening tool that involves obtaining X-ray images of the breast tissue. This procedure is capable of detecting minute abnormalities, such as small lumps or calcifications, before they can be felt by hand. It is especially valuable in detecting early-stage breast cancer, allowing for timely intervention and reducing the likelihood of disease progression. Mammograms are typically recommended as a routine screening method for women above a certain age or those with specific risk factors. Clinical breast exams are conducted by healthcare professionals who possess the expertise to detect any irregularities or changes in the breast tissue. During the exam, the healthcare provider carefully examines both the breasts and the surrounding areas, checking for lumps, variations in texture, or other signs that may warrant further investigation. This thorough evaluation performed by a trained professional ensures a comprehensive assessment and provides an additional layer of scrutiny beyond self-examinations. Self-breast exams empower individuals to become actively involved in their breast health. By regularly examining their own breasts, individuals become familiar with the normal look and feel of their breast tissue. This knowledge allows them to detect any subtle changes promptly. Self-breast exams are typically conducted by gently palpating the breasts in a systematic manner, feeling for any lumps, thickening, or other unusual characteristics. It is important to note that while self-exams can be an invaluable tool, they should not replace regular clinical breast exams or mammograms. Treatment options. When it comes to breast cancer treatment, there are several factors that healthcare professionals consider in order to tailor the approach to each individual patient's needs. These factors include the stage of cancer, the type of breast cancer, and the specific characteristics of the patient themselves. Taking all of these variables into account, healthcare teams can develop a treatment plan that offers the best chance for successful outcomes. One of the primary treatment modalities for breast cancer is surgery. Surgical options may include a lumpectomy, which involves the removal of the tumor and a small margin of surrounding healthy tissue, or a mastectomy, which involves the complete removal of the breast tissue. The choice between these options is often based on the size and location of the tumor, as well as the patient's personal preferences and overall health. In addition to surgery, other treatment approaches may be recommended depending on the individual case. Radiation therapy is a common method used to destroy cancer cells and reduce the risk of recurrence. It involves the targeted application of high-energy rays to the affected area. Radiation therapy may be administered externally or internally, depending on the specific circumstances. Chemotherapy is another important treatment option that utilizes powerful medications to destroy cancer cells throughout the body. These medications are often given intravenously or in pill form and are designed to target rapidly dividing cells, including cancer cells. Chemotherapy is often used in cases where the cancer has spread beyond the breast or if there is a high risk of recurrence. Hormone therapy is typically recommended for patients with hormone receptor-positive breast cancer, which means that the cancer cells have receptors that respond to estrogen or progesterone. This type of therapy aims to block the effects of these hormones or reduce their production, effectively inhibiting the growth of hormone-sensitive tumors. Hormone therapy may involve medications, such as selective estrogen receptor modulators, SERMs, aromatase inhibitors, or ovarian suppression. In cases where breast cancer cells have specific genetic mutations, targeted therapy may be considered. Targeted therapy drugs are designed to identify and attack specific molecules or pathways that contribute to cancer growth. For example, drugs like trastuzumab and pertuzumab target the HER2 protein, which is overexpressed in some breast cancers. By blocking the HER2 protein, these medications can slow down or even stop the growth of cancer cells. It's important to note that each treatment option carries its own benefits and potential side effects. The decision-making process should involve an open and informed discussion between the patient and their healthcare team. Lifestyle choices and prevention. Adopting a healthy lifestyle is an essential step in reducing the risk of developing breast cancer. While it's important to note that not all breast cancers can be prevented, implementing certain strategies can significantly lower the chances of developing the disease. 1. Maintain a healthy weight through regular exercise and a balanced diet. Maintaining a healthy weight is crucial as obesity has been linked to an increased risk of breast cancer, particularly in postmenopausal women. Engaging in regular physical activity not only helps with weight management but also offers numerous other health benefits. Exercise helps regulate hormone levels, reduces inflammation, and boosts the immune system, all of which play a role in reducing the risk of breast cancer. Aim for at least 150 minutes of moderate intensity exercise or 75 minutes of vigorous intensity exercise per week. Additionally, incorporating a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats can provide essential nutrients and antioxidants that support overall health and may lower the risk of breast cancer. 2. Limit alcohol consumption. Studies have consistently shown that there is a direct link between alcohol consumption and an increased risk of breast cancer. Even moderate alcohol intake can raise the risk, so it's important to be mindful of your alcohol consumption. If you choose to drink, it is recommended to limit it to no more than 1 alcoholic drink per day. 3. Breastfeed, if possible, as it has been linked to a reduced risk of breast cancer. Breastfeeding offers numerous benefits for both the mother and the baby, and research suggests that it can lower the risk of breast cancer. The longer a woman breastfeeds, the greater the protective effect may be. Breastfeeding helps to reduce the total number of menstrual cycles a woman has in her lifetime, thereby decreasing the overall exposure to estrogen, a hormone that can promote the development of certain types of breast cancer. 4. Avoid exposure to environmental pollutants and unnecessary radiation. Reducing exposure to environmental pollutants and unnecessary radiation is an important aspect of breast cancer prevention. Minimizing exposure to harmful substances and chemicals found in certain household products, cosmetics, pesticides, and industrial pollutants can help reduce the risk. It is advisable to choose organic and natural products whenever possible and to follow safety guidelines when using chemicals. Additionally, limit exposure to unnecessary radiation, such as repeated medical imaging tests that use ionizing radiation. While medical imaging tests are necessary for diagnosis and treatment purposes, it's important to have a discussion with your healthcare provider about the potential risks and benefits before undergoing any procedures. Breast cancer is a formidable opponent, but armed with knowledge and a commitment to a healthy lifestyle, we can take steps to reduce its impact. Remember, early detection is key, so be proactive in understanding the risk factors, recognizing signs and symptoms, and engaging in regular screenings. Together, let's empower ourselves and those around us with information that can lead to healthier lives. Stay informed, stay vigilant, and continue to prioritize your well-being. Until next time, stay healthy.